All right, it is 1:30 according to the atomic clock I have here in my dining room. So we are going to get started. The first thing that I want to mention is, let me just share my, oops. The host has disabled participant screen sharing, so I'll just kind of run over a couple of ground rules. We wanted to see all of your bright shining faces right off the bat. So once we get going, we want you to mute your audio, please. And also turn off your cameras, because otherwise there will be a whole bunch of little thumbnails depending on your gallery view. So turn off your camera for now, and to use chat if you want to submit questions. And we have set that up so that you can submit your questions to Marina Keers, who's the chat moderator. Okay, and you can submit questions throughout, but we will be setting aside some time at the very, very end of this panel discussion for the Q&A. And in case you're wondering, my name is Deborah Jones. You have received probably messages from me starting from way back in December when we were originally trying to get together and were unable to 2 or 3 times. So now what we want to do is see your faces and talk a little bit about the situation that we find ourselves in here October 6th of 2020, when long ago we expected already to have had a kickoff meeting. What I want to do is to introduce the panelists, and I'm going to just say Patty, and I want you to give me your name and your position, your center name, and are you open, close, or something in between? Patty, you want to start?
All right. I am Patty Davis. I'm at the Fort Wayne Parks and Recreation Department Community Center in Fort Wayne. And we are opened as of June 15th.
Dan?
I'm Dan Mustard. I'm the Executive Director at Millrace Center in Columbus. I'm also the Secretary of the Indiana Commission on Aging.
And when did are you open, closed, or something in between?
We are open. We actually reopened on June 15th. We closed on March 13th and then reopened again on June 15th.
And Beverly?
I'm Beverly Ferry with Living Well in Wabash County, which is the Council on Aging. And we have our senior center, which is Winchester Senior Center, which is something else other than open and closed. And we also have a satellite senior center, which has basically been something else as well.
Okay, so you're an in-between person.
We are in between. Mm-hmm.
For those who are just arriving, I'd like to mention a couple of rules of code for this particular webinar. If you could make sure that you mute your mic, I could hear some typing, some keyboard typing. And also we're going with no video at this point for everybody except for the panelists, okay?
What you want? Do you want Blackberry or Beach?
So let's get going. We've already heard we've got 2 that are open.
It's hard.
That is in between. So let me start with you, Beverly. When did you make key decisions about being open or closed? And tell me, what were those deliberations like with your board?
Can we wait till everybody is muted? Can we get it? Oh, good. Okay.
Good. Oh, good. Sounds good.
Actually, space was a key consideration for us, because when we were looking at social distancing, going with 6 feet around in our main room, we could have only had 20 people. And so if you put in anything else, it gets pretty small. In the summer, we were able to do outside activities, but our considerations, of course, were safety. And the other thing was, with it being closed from March on, we discovered an entire new group of people that we had not met. They were people who considered themselves independent and yet became isolated as a result of COVID. So with part-time staff members, we have 2 people who work 2 days each for the senior center, and then we supplement. we honestly do not have the staffing that we will need to fully open. So those were considerations, space and money. And of course, we wanted to make sure that we were able to safely operate. We're very busy and providing a lot, but our doors are not open.
Okay, good. So you were saying that you don't have the staff at the moment. I just want to pursue this before we jump over to Dan and Patty. How long do you expect that to be the case?
Well, here's the thing. Our operating model for our senior center was based on not needing a full coverage, and we could piecemeal. We had maybe one person that was a point person. They were here for 16 years and we haven't been able to replace them. Who knows? But we've got some part-time people. So we've moved to a new business model. The problem is, and I've said this from the beginning of COVID, taking care of COVID was one thing, but the really expensive part is reopening. And it's not just because of the PPE and all that. It's because our old model is not going to work. For one thing, we've discovered about 150 people we didn't know about.
Oh, wow.
And we're connecting with them. They may never make it inside, but in terms of connections and providing services and, giving them things to do in terms of, mental stimulation and connections, we have a whole new, and I think this is something senior centers across the country have found.
I think that's right. And we're going to pursue that in a little bit, because I want to hear from the others as far as when you decided to open. Both Patty and Dan have been open since June 15th.
Right.
That's kind of interesting. So Patty, next, what went into the deliberations that you had at your center to figure out when to open and how to open? I think the hard part is muting and unmuting, and I'm not able to unmute Patty. Dan, can you unmute?
Yeah, I'm trying to do that right now.
Okay, good. There you go, Patty.
Okay. Basically, we went by the stages for one thing, is what we looked at actually as a whole department.
Now, when you say stages, you mean the state determined stages?
Yes, the state stages that were set up. We really looked at those and followed those as a whole department first. And then started doing a lot of research and to looking at other areas, even in the US and that, about how they opened and that. I put a written plan together, got it approved by the Board of Health and my superiors, and with the help of my staff, and that we got everything in order and opened up on June 15th.
So when you say the department, you're with Parks and Rec. I just want to remind all listeners that your senior center is part of Parks and Rec. So that kind of meant you went along with everything else that was happening in Parks and Rec?
Right. We're under the umbrella of City of Fort Wayne and Fort Wayne Parks and Recreation. So, with those procedures, we followed that very closely. And then when it looked to reopening and what we could reopen, then took facility by facility managers to try to put a plan together and get that approved. And we sent in a whole list of questions to Board of Health ahead of time. Did a lot of research ahead of time to do it. When we did open, we were very limited on what we opened at the beginning. Anything that we could social distance with, of course, we had to go through it and change our numbers up from where we normally have 45 people in exercise class is now down to a maximum of 30 in the space that we have, figuring out room to room, how many we could hold in each room. And then that's how we figured out what programs we could hold also by our numbers with the social distancing and that. And we also have masks that we can supply to anybody that comes in that does not have masks. We have not had any issue since June 15th on people wearing the masks that come in.
That's terrific. Dan, is that the case at Millrace Center in Bartholomew County?
Yeah, we had been working pretty closely with the COVID task force here, as well as the health department, because we actually had several of the very first cases in Bartholomew County. There were folks who, two folks who came in and were using our fitness center. And then we also had a singing group who were meeting here. That I think they met here on March the 9th.
Wow.
And then we were aware of the fact that 7 out of the 10 people became infected with COVID. And that was really a perfect storm because they were all in close proximity. They were singing, and this was before we really had information about what was going on and really how, the best way that it was spread. So right from the very beginning, we were aware of how infectious this could be. So I think that we went into it with our eyes pretty well opened because some folks got very sick. We didn't lose anybody, thankfully. But at the same time, I think the key for us in the deliberation about whether to open or not was, and I'm sure we'll get into this more, the discussion of isolation. But the thing that really triggered something for us was the fact that we normally track mortality every year. We keep track of how many members we lose on a yearly basis. And we typically lose between 50 to 55 people. We have about a 2,000 membership here. And we had already seen that number by June 1st. So we were already closing in on what we normally would lose in a year's time. And most of it was in April and May. And we could not correlate that big increase. And we were working with the health department to get numbers from them because it was throughout the community that we were seeing it. And that increase in mortality couldn't be attributed directly to COVID in terms of the numbers of people who were passing away with COVID. So the only thing at that point that we could attribute it to was the impact of isolation and some of that. So that really pushed us. And then we just used CDC guidelines, some information from the state, and we kind of jumped ahead to June 15th. That was the date that we felt we could legally open, and we did. Kind of knowing what we were in for, or at least the risk, because we'd already experienced some illness, and we thought that we would, going into it, we would know how serious it can be, and so we would make sure that we took all the measures that we could to keep people safe.
And yet that seems pretty early, June 15th, in both cases. Now we've got here different business models because we've got Parks and Rec. We have, in Dan's case, it's more of a free, I can't say freestanding exactly,
Independently
but
operated. Yeah.
So in addition to the variety of business models we have with Beverly and Patty and Dan, I think we also have kind of a patchwork quilt of approach in terms of jurisdiction and whose guidelines you're going to follow. So how did that complicate, or did that complicate things at all for all of you? I'll start back with Beverly.
Well, there's one more entity that we work closely with, and that would be NDOT, because we also have public and senior transportation. And the other entity is our area agency, because they provide the meals. So we were listening to the state, looking at our local numbers, talking to some of our doctors. And at one point I said to my doctor, "What do you think?" She said, "Don't open." I mean, I'll take that advice. So we're looking at the numbers like everybody else. The problem was for us, when the announcement was made that we were going to stage 5 for the state and you could open up, nobody heard the governor's comments, senior centers and nutrition sites open up with precaution. Nobody heard that. Everybody heard the rest.
Patty?
And
in terms of guidelines.
What's that? I'm sorry.
I said in terms of guidelines for reopening and timelines too.
Timelines, guidelines, like I said, we had to go by the city guidelines for opening, and that once for a while, some staff was working from home. We were fortunate enough to not lose any staff. during this whole time. So by just, once again, doing a lot of research, and that we just followed what our regular Parks Department programming was doing. And we actually were the first ones to open in Fort Wayne parks to the public. But we had a lot of input, of course, from older adults that were calling us wanting to come. Some of the people that didn't understand the COVID and were kind of the anti policy followers. But I mean, we just really looked into, okay, what can we have? Okay, we can't social distance with playing euchre. We can't social distance with bridge. The things that we could not logically social distance with, and that was going to be any harm to the patrons, we're not, and we're still not doing. But when it came to June 15th, we had a lot of communication in that, and we just decided this is the time to open. Let's see how it goes. And actually, every week we grow more and more people. More and more people are coming back.
Now, Dan, you made reference to the health department too. Dare I say, lack of one consistent set of statewide reopening protocols. Where did you turn besides the health department?
Yeah, like I said, we had the COVID task force, and there had been some discussion among some senior center leaders, just kind of saying, what are you guys going to be doing? And we put together kind of some guidelines and just trying to piece information together and applying it to senior centers. And so that was part of it. And then rather than waiting for permission, we just presented our plan to the COVID task force and said, this is why we feel, that we have to reopen because we're seeing the impact of isolation. This is our plan, and unless there's an objection, we're going to open on June 15th. And so that's what we did.
Deborah, if I could add, one of the documents that we got that we found very helpful was the Massachusetts guidelines for senior centers opening. And that's what we went with. And then also, there may be others, but I participated in the NISC, the National Council on Aging's webinars that they talked about what each state was doing. And I believe you might be able to still get those online through ncoa.org.
Okay, that's a good resource. Let me write that down because we'll be doing a follow-up communication. And in addition to the emails of our panelists, who are happy to take questions that you may want to direct to them individually, we'll also have some other resources in there. The word that I keep hearing is isolation. So let's not put off that anymore. In fact, I think the quote of this whole pandemic experience can be attributed to Stephanie Bramlett, who leads the Beech Grove Center. And she said, we're not losing our people to COVID, we're losing them to dementia. So I'd like to have comments. Let's start with Dan this time.
Yeah, we do Meals on Wheels, and that was one of the areas where we really saw people starting to decline, in physical appearance. And then there were other folks, because we had closed the center on March 13th, we immediately started making phone calls to people, and then we would do that on a regular basis every, once a week at least. And we were just, it was anecdotal, but we could see the physical decline in people as we were delivering meals. And those were folks who already, to a degree, were isolated. But I think the anxiety, the additional anxiety of the pandemic on top of that really added to it. And then the conversations that we were having with people and self-reporting the fact that they were sleeping longer, they weren't physically active, they weren't exercising. A lot of things that really caused us a lot of concern. And we already knew the impact of isolation. It's kind of a core part of our mission. And so, that's what really caused us the concern. And then when we saw the numbers of people, we could see it again, kind of anecdotally, we pick up the newspaper every morning and you'd see twice as many obituaries as you normally saw. And people were, beginning to comment about that. It's like, wow, what's going on? So I think a lot of people were kind of aware of it without necessarily being able to put a name to it. But I think we could all see the impact that isolation was having on folks.
In fact, if I can just throw in a comment, I read a piece of research that talked about a high resting heart rate and how if it is high, that's associated with cardiac events. Well, a lot of the people who are experiencing the stress of isolation have high resting heart rates. So it could be that some of the mortality we're seeing, while not COVID related, may be cardiac related, which could also have been triggered just by the stress of being alone.
Right.
Patty, I think you're nodding. Do you agree on the isolation piece?
Yes. And, that was one big concern with myself and my staff when this all happened, knowing that there are people that come to our building every day, and this is their social life. And so we started off right away, all the staff contacting our volunteers. We have 169 volunteers, and we divided and conquered and contacted all the volunteers. We continually, through this process, would contact the volunteers kind of on a weekly basis just to check in. We would take turns on who we chose so that they talked to different people. We also did, our main front desk is ran by volunteers. We put gift packs together, like survival kits together, and we went out and delivered them at their front doors to them. We did postcards with all our pictures spelling "We miss you," and sent postcards out for in May for activities. They would call in. We would let them know they could call us anytime. It really didn't matter. Call in if they needed to talk, if they needed something, we would be there to help them. And yes, our base is very large, but we get to know the people so much that we knew kind of who is alone in that also. So we did a lot of phone contact with our participants that we knew live alone and with our volunteers in that. And it was absolutely amazing on how much that made an impact on some of them. Mm-hmm. I mean, they looked forward for those calls to come. So isolation, and when we did open, people starting to come back, I was just like amazed on the condition. They were like walking like they were 10 years older than they were until they really got back into the groove of things. And that was kind of sad. I mean, that was really sad seeing that happen, but now they're getting in the groove and it's getting a little better, but it was not fun.
So Beverly, on the same topic, the 150 new people that you talked about, were they kind of brought to you through their need to deal with isolation?
Yes, we did. We do a weekly full page color ad in the local free newspaper. And so we started promoting immediately a friendly collar program, which went from 1 person prior to COVID to 300. Also, we never delivered meals before. I mean, we have them at the lunch site, but they ate in. And we went to delivering, and that more than doubled the number with nutrition site. Also, our pantry, we were delivering to people instead of having them come. Same thing in our public transit. But those new people, we ended up developing a senior packet, which is probably not anything new to anybody else, but we never concentrated on people out there. We tried to get them to come in, and this was a complete reversal for us. So now we do a monthly senior activity packet. Some months I call it a sunshine packet. It's so big now, and it goes to another 300 people, but we're now going to have to send them to the printer because it's that large to have them put together. And we're sending them out or delivering with meals. And it's become quite a thing. And in addition, we never used to mail our newsletters. We relied on people picking them up at the grocery store, at the doctor's office, at the bank. And now with COVID, we're mailing, it's over 1,000. That doesn't sound like much to anybody, but we were never mailing. So because of mailing the newsletters, putting out the information in the newspapers, and also radio contact, people have been calling in, and the food and the meals were the two biggest things that actually became outreach tools, where people self-identified, people who we never had met before. So our numbers range. We might have 200 or 220 that we're mailing for one thing, but then you've got the 800 or 1,000 you're doing on this end. So it's varied. I will say though, for the caller program, once we hit warm weather, people weren't answering the phones. It kind of declined, but we think that we'll have a reversal as we go back. Now, we still have to figure out, because we had outdoor activities, and we are doing outdoor activities. We're doing drive-by parties and that kind of thing, with birthday party and Halloween. And we are thinking that, we'll have to figure out what we can do inside.
Winter.
Space is an issue.
Yeah.
And I don't know if those other people will want to connect with us any other way than what they are now. We don't know.
So we're talking lots and lots of new territory here, aren't we?
And that was when I said the business models change.
Right, exactly. Let me just take a minute, because I know we've had some people join after we did our initial introduction. So quickly, we're talking with Dan Mustard, Bartholomew County, Beverly Ferry, Wabash County, Patty Davis, Allen County. These are our panelists. I'm Deborah Jones, moderator. And just want to make sure, if you have a question, please use the chat feature and send your question to Marina Keers. She's identified also as our chat moderator. And we'll be taking some time toward the end of the hour to address some of those questions. Okay, let's move along then. So it looks like the social isolation has been the real common denominator here. With that in mind, and listening to some of the innovative things that people have done and changing business models and coming up with new ways of contacting people, give me some more of the silver linings or the lessons learned from this whole experience, because, it's like nothing we've ever experienced before. And I'll start with Patty this time.
First thing I learned is there's no definite in a day. Things were changing minute by minute. But, basically, we learned that, and we knew this, that there are people out there that needed help and that needed our assistance, and that we were the community center for older adults, and that we needed to reach out and help them on how they really needed the help, however it was. They needed groceries, whatever it was. But it just goes to show, you hear they're always talking about the pandemics and stuff, and and to have all the food ready and stuff, and me for one was kind of the same way. It was like, well, when it happens, then I'll get the stuff together. But it just totally changes your attitude, because I was one too. I didn't want to go out to the grocery store. I didn't want to do that. Was to actually be prepared. Don't leave your house empty with the, no food, anything like that, because when something like this jumps up, you don't know. And, this virus is coming so quickly to people that you're feeling good one day and the next day you could be totally down. And so it's actually, I would say, taught us really to be, pay attention to what we're doing and just be more prepared on what's going on. Emphasize, before we actually had the shutdown, we already had hand sanitizer dispensers in each room. We were doing that already for the flu season in that, not knowing of the others. So I would say there's really nothing is unnecessary. Do it. And it just happened for us that we were very well prepared because we had some of the things already in place before the COVID hit.
Dan, silver linings. I know in our preparatory meetings, I was all doom and gloom, and you said, "Wait a minute, how about the silver linings?" So come on, give us some.
Well, one of the things right off the bat for us was we pivoted pretty quickly. We were closed for a few days, and we said, okay, obviously this isn't going to work. How do we still help people who are trying to shelter at home? And so we switched really quickly to start developing virtual programming. So we kind of cobbled together a little cheesy video system and started recording our own programming here in our conference room, which now looks more like a TV studio, but it's our conference room. And we, basically we just pieced together stuff and right away started doing some of our more popular classes and recording them and then posting them on our website. And they were very popular with people who had time, they were sitting at home. And I think it helped people feel connected. And then we realized that we were reaching people, as Bev said before, we were reaching people who weren't members, who had never been to the senior center, but they were stuck at home. And they're like, well, we were sharing stuff on Facebook, the links and things. And it kind of took on a life of its own. And so now we know moving forward that that's something that we will continue to do, because not everybody's able to come to a physical building, but we'll be able to still reach people through virtual programming. And we did fitness classes and entertainment and all kinds of things. We already had some folks who were scheduled to come in and do musical performances who obviously couldn't do that. So we just went ahead and had them come in. I recorded them in here in our conference room, and we posted that stuff. So it was still a way for artists to be able to connect with audiences and for our folks to get some entertainment types of programs. That's definitely one thing. The other thing that was really a surprise to me was when the weather got a little bit better, and we did something we called the 100-mile challenge to encourage people to still do something for physical fitness. And so our program director put together a sheet. People could fill in little circles. There was like 100 circles on a sheet. So for every mile, they would do that. And we were trying to get people to see if they could walk over the course of a couple of months, either walk or ride bike or, something in their workouts, counting steps to do miles. We ended up, this thing just took off like crazy. We had sheets, the equivalent of 25,000 miles of people participating, which for reference is once around the equator. That was crazy to me, the popularity of it. And people, the prize was a free membership and a t-shirt. So, but again, that's something that we'll continue to do because it was incredibly popular with people, and it gave a lot of folks. We had one married couple, they each lost 60 pounds.
Wow.
By doing,
oh my gosh.
Yeah. So, those are the kinds of things that we probably would not have done that because we have this, we have the physical space. People come in and they do things, and we just wouldn't have thought about that. So there were definitely some things that we've learned moving forward.
Beverly, you got some lessons, some silver linings?
Absolutely. And I think technology has to top the list. Is that, like many senior centers across the country, we've always thought about it. We've been on the edge, but just never got to it. And this pushed us, along with hundreds of other centers across the country, across that line. Our 3-day-a-week low-impact fitness class became a 3-day-a-week Facebook Live program, which then became a 3-day-a-week outdoor in the morning in the shade class, along with Facebook Live. And I think it will never drop Facebook Live. I think it will always be along with the live program. That's the silver lining. I think the value of our collaborations and that we're not in this by ourselves, and that was a big thing. And also realizing that we could do a better job of communicating.
Interesting. Okay.
There's so much, I don't know how to explain it, but except that nobody wants to think about aging. And I think it's that hidden thing about the death is at the other end, but we don't want to talk about it. So we've discovered, like, I now do My Perspective. I do a My Perspective column in our newsletter. So now once a month I'm doing a My Perspective, and we promote it. In October, it's going to be Take the Fright Out of Aging. And each month we're taking a topic and just kind of blowing it out of the water and talking about what it means to us. And I'm a senior, so I could talk about it. We've gotten really positive feedback about that, just plain discussion of what does it mean to not have a 50-year-old body, that kind of thing. And, I mean, right? My mother thought at 94, she thought she should still be a 50-year-old. And so we talk about those things. That's the big thing, was the need to talk about what we were going through and aging. And so in October, we have a mental health clinic we're collaborating with. They're going to do a 3-part series on COVID and the holidays. So again, it's communicating and it's talking about this stuff, because they're not able maybe to talk to their families or their friends now because they're stuck. The other thing I will say is that I don't know how much of a crowd we would have if we opened. I am hearing from a lot of seniors that they won't come back until there's a safe vaccine. And I mean, we're kind of in the middle of wondering, what do we do? And especially also our center isn't that big, so we can't, maybe we wouldn't have more than 20 people at a time at the most. So the silver lining is the value of our collaborations, the potential we had to grow with our communications, and the fact that it booted us over the line to try technology. We're still not there. I want a TV crew like Dan's. I do. I want that. I do. I want it.
Right.
But, those things that pushed us to find other ways. And in essence, we also found that we needed to do more than invite people in. We have got to get them where they are.
Yeah, you mentioned something about people fearing, not wanting to come out. And quite frankly, I took a sneak peek at a question that came in because it went out to everyone and it popped up on the screen. And we had one of our senior leaders say, I'm just surprised at how few people are turning out. And I think that's something maybe we should address as well. Okay, well, we got the center open and we've got our PPE and we've got everything and big dots on the floor. How come people aren't coming out? Patty, are you having that experience where the numbers of people are surprising because they're low?
At the beginning, they were low, and I can tell you what we found. Those brave ones that came out right away, all their buddies in that were waiting for them kind of to be the scapegoat to figure out, okay, go in, is it safe? Is it, and then by word of mouth, we kept picking people up. And how we know that is they would tell us, well, we were afraid to come at the beginning, but such and such told us what all your processes were. And so now we're coming. And so we've had a lot of that. It's just been the word of mouth that, Lucy's coming and she's comfortable. So now I'll come. But I was actually surprised at the beginning how many we did have come. And, but now I'm surprised it is building. Even with, as we go along here and all these numbers, that we have increased still our exercise programs, and that, we're running 30 people at a time for classes, and our adult evening classes are going strong. So it's a big splurge all of a sudden for the fall, though, that it's picking up. So it did start out slow and it was still a little depressing, but in some ways it was great just to have people in our building, because the staff, we got tired of each other.
Deborah, our issue is that we're in a very conservative community, and there are a lot of people that haven't taken this seriously for one reason or another. But we've really taken the stance of really trying to promote mask wearing, really trying to promote the hand washing. We're really trying to promote all that. And it's going to be tough for us to turn it all, and suddenly I'm not sure how we'll do it all, because we've now, like, there's more dimension to us than there was before. Because I don't want to drop the people who are cautious along with the ones who are more, ambitious. We honestly did not have the crowds that we thought we could have with the outside things. Now we did have, we have like 9 people show up to exercise. Okay, that's good. But 9, I can't fit 9 people in the building for exercise with everything else that's in the room. So I don't know what we're going to do.
Okay. Dan?
Yeah, and I think Beverly's point is really good. I mean, it's a little bit easier for us to say, well, yeah, we were able to reopen, but this is a 24,000 square foot facility, and we've got a multi-purpose room. That makes a huge difference. Not to discourage the smaller centers, but I mean, that's part of it, that you have to weigh the number of people that you can physically distance. So right now, as I'm looking out, we have a lot of glass in the interior of this building. And I'm looking at our bodies in motion class that normally, pre-COVID would have had 50 to 55 people in it. And now we're limited at less than 20. And that's in 2/3 of the multi-purpose room. So that's a big limiting factor, in terms of what we're able to do. So that was a big part of it for us, was to, kind of look at that and go, okay, how do we do this? So we had to go through and measure and figure out how many people per room, and then do the activity. The other thing that I would point out related to the question was, some folks were asking about how we sign people up, and was there were people okay with that? Because one of the safeguards that we put in place was that people had to register ahead of time for every single activity. So we don't have anything drop in right now. So that way we could control the numbers and make sure that there was enough space for people to be physically distanced. And like Bev, we had some folks that I know do not agree with the idea of wearing masks, but they have been very gracious about, when they come in, that's the ground rules. They have to wear a mask, and they do. And we've had virtually no pushback about it. We've never had anybody challenge the rule. People have been, even if they don't agree with it, and they say, if they think that COVID was a hoax and that mask wearing is counterproductive, they still do it when they come in the building. And, so I don't know if that's out of respect for their fellow members, or they just were so tired of sitting at home that they would do anything to get out and be around people. Whatever the reason, it really hasn't been an issue for us. Surprisingly so. I was kind of shocked. And we do still have a few people that say they will not leave their house until there's a vaccine.
Yeah. Yeah. I mean, I think that's pretty reflective of society in general. I do want to turn to questions, and then I have one question for the panel that we'll say for the very end for your closing remarks. But I want now to turn to Marina and find out what kind of questions we're getting from our group.
Sure. Well, thank you to everyone who's been sharing such good information in the chats. There's a lot of people commenting about their programming. And one thing that I think is interesting that came out of the chat that I'd like to hear from the panel, maybe others would, is one gave an example that they had to reclose their senior center. So apart from a government shutdown, again, would you have you put in plans in place to, what would trigger you to close or limit activities or pull back? Have you done that work to determine what that would look like?
Let's start with Beverly on that one.
For us, who we had not fully opened yet, we are still waiting for a steady decline in cases in our area. And so an increase would definitely stop everything. But like I said, we are doing a lot already. It's just not doing it the same way we used to.
Dan?
And for us, we have had the discussion, and we have kind of our plan B. And for us, it would be infection in the building. If contact tracing traced people back to our facility, then we would close, especially if it was more than one person. So we have some criteria that we're doing. So far we haven't had that happen, and we're keeping our fingers crossed. And just last week, I sent an email out to the staff to say, this is not the time to get overconfident. And I think that in general, people are just exhausted, and they're tired of wearing masks. They're tired of having to constantly, as soon as a group is done, we go through and we clean the room. And it's wearing everybody out, but we have to do it. And this is not the time to let down our guard, because all it takes is 1 or 2 cases and we're closed again. And, I don't know that we would survive another full closure. So, this is not the time to relax our precautions.
Patty, how about in your Parks and Rec department? What would force a reclosure?
Watching the numbers, of course, if we would happen to have an outbreak here, I would say that they would, have us closed down depending on the situation, even for recleaning and that. I can tell you now, that's my biggest fear is somebody here having it. Therefore, we are very, my maintenance guy has a ionized sanitizer. After somebody gets up off that seat, he's like Johnny on the spot, sanitizing, constantly cleaning and that. So we've luckily only had a husband of a participant, and she hadn't even been around here lately. So we've been very fortunate, but we will follow the Board of Health guidelines and, of course, the city guidelines on what they would tell us for closing, opening, closing. But, we stand very strong with our sanitizing and making sure that it's done several times a day. We've even gone to reduce the money handling and that, have gone to punch cards and stuff like that. So, we kind of have the backup plan if we have to close, for cleaning, with the contact tracing and that. We will certainly do that. But I got a very, very conscientious staff right now on that. So I'm very confident that we're doing well with that.
Deborah, if I could add, we are waiting. We have written a grant. There was some grant money. Different counties had it. I don't know if everybody did, but if someone's looking for assistance, we went through our United Fund, United Way, and they had Lilly Foundation funding for assistance with that. So we just now have gotten the approval to buy the partitions that we'd have at the serving windows, the partitions at the front desk, the sanitizing stations that we're putting. And so we've not received any of that yet, but we did not get our center ready for anyone because we were waiting on the funding to get approved.
And you know what? You're just kind of giving us a preview of our next webinar about. So I'm going to cut you off right there because I want to take some more questions from Marina.
Sure. Another question that was asked is anyone being heavily influenced by outside entities as to when their seniors can meet again in the center? And they gave an example in the chat of their area agency on aging asking that they not reopen until January. So apart from health departments and others, are you, now we know that Dan and Patty are open, but is anyone else experiencing that or getting pressure from those outside entities that you are aware of or that you would feel comfortable sharing from the panel?
I'll say that for us, we are independent. I mean, we collaborate with a lot of different groups, public and private, but we stand on our own. We're a council on aging. We're a 501c3. We're not a part of the city. We're not a part of we share with a whole lot of things. And it comes down to my board being comfortable. And we've not been told by anybody. In fact, I think it would have been great if the state could have put out some guidelines for everyone. I think that would have really helped. Instead, we had to kind of like go find out what Massachusetts was doing.
In fact, let's have one panelist answer a question so we can get some more in, because I have a feeling that we've got a lot. Go ahead, Marina.
Yeah, so even in the comments, and then a question came out of it. Several people have commented that they have cards happening or bingo, and then others are saying that they are not doing that because of social distancing and sharing the activity, the equipment for the activity. So, how do you make a decision about whether or not to have an activity where there are shared equipment like cards or a game? Maybe Dan can answer that one.
Yeah, we still are not doing cards or bingo. There were a couple things that we did to kind of guide that. Number one is we tried to prioritize physical activity when we could, and we know that there are a lot of folks that that really needed that, and so we prioritized those, and we expanded the number of sessions. So like our Bodies in Motion went from 3 days a week to 5 days a week, morning and afternoon. So that we could get more people in to do that. And so there were some things that had to go. And because cards and bingo were such a high touch kind of thing, and it was really difficult to physically distance, we just said, we're not going to do that for a while. And people, they weren't happy, but they understood the reasoning behind it. I mean, it kind of made sense in the bigger scheme of what we were trying to accomplish. And as long as it doesn't look random, and that we're targeting a particular group, people have kind of accepted our decisions based on that. I think they understand that we're trying to do the best that we can under difficult circumstances, and we want to keep people safe.
I've heard that euchre players can be very, very powerful in their request to play, and it's kind of hard for them not to. So,
A question that came that really, I think, Beverly, it's to you. You mentioned the mailing of the 1,000 newsletters. And one question was, did you find a sponsor for that? Because so many of the businesses that support our senior centers are hurting right now financially. And so did you find a sponsor for that, or did you pull it out of a different line in your budget?
We kind of pulled it out of the budget where we weren't doing things. I do think, though, that like our senior packet that we mail, that's very expensive to do. I mean, it's surprising at what it costs. I think there's potential for sponsorships, but I would agree. I think it'd be better to have like families sponsor it in like in honor of a grandparent or something, because we would not go to our small businesses at this time.
Probably 2 more questions. I'm looking at the clock and I want to be respectful of everyone's schedule. So let's try 2 more questions.
So this one, I'm not sure if those on the panel could answer it or not, but one was asking, is there a way that anyone has determined to configure cards and games while social distancing? So Dan, you already mentioned that you're not doing that because you can't see how that would work. Beverly is not doing that. Patty, you're
bingo.
shaking your head.
Bingo.
Okay.
Gallon size Ziploc bags, put bingo cards back to back inside it. All we have to do is wipe the outside of the bags afterwards. The other thought with euchre would be to have a partition done with plexiglass underneath. You could share, but you would have to either sanitize before and after or wear gloves and change them each time.
Yeah, someone else in the comments said that they are using paper cards for bingo. So that's another option. And then another is doing a parking lot bingo with a transmitter. And then I also wanted to mention in the chat, there is a link to the Division of Aging. And so Deborah, maybe we can get that into the notes about the guidance for senior centers reopening from FSSA.
Oh, great. Excellent. I think we
Yeah.
have Christy Garner on from FSSA. Okay.
Yeah,
Very
and
good.
that was from Ms. Gardner. So yeah, thank you for doing that or for sharing that. And I believe that I have made my way through. I will mention too, another comment that people had is the multiple sessions, which Dan mentioned, that where your space is small and you couldn't have as many individuals in the in the space at one time, then having multiple sessions might allow you to serve a greater number of individuals if that would be accommodated. But I don't see any other questions, Deborah, in the chat.
Okay, very good. I'm hoping that we touched on something that has meaning for absolutely everybody out there, and that gives us time for this final kind of philosophical question for the three panelists. And you each have about 30 seconds to answer. So given what we talked about with social isolation and everything else having to do with keeping seniors healthy, what are ways that senior-centered leadership can influence community-wide planning for future pandemics or other emergencies? What do we have to offer when we think about going forward when this could happen again? And let's start with Dan this time, because he was nodding, so he must have something on his mind.
Well, yes and no. Just quickly, I think one of the things that became really apparent and is probably something that we will hopefully be able to build on in the future is that there's a lot of ageism that goes on that I think people aren't even aware of. And the fact that it took a pandemic to realize that there are some unique needs among seniors, and we aren't necessarily well positioned to be able to meet those needs kind of as a society. And so hopefully moving forward, it has opened some people's eyes to the fact that we need to make sure that senior issues are represented and people are at the table, that there are advocates at the table for planning in general, and that that senior needs have to be addressed and met when we do those types of planning, because I don't think anybody had really thought about it.
Now, Patty, in your case, where you're part of Parks and Rec, how do you surface the needs of seniors when you're in a larger department, especially going forward?
We do a lot of different seminars as it is, but we've talked about doing a series of seminars to kind of help to plan for the future like that. I think the biggest thing that we need to do is, number one, make sure that the older adults know that they can trust us and believe us, and to educate them and gain their trust so that they will do something about it. So, we're planning a whole education series on this, of what to do, what not to do, but more so how to prepare and the thinking way. And part of it, of course, a big with the mental health right now. We're doing that. Actually, we're doing that as the state parks wide right now, doing some mental health series and stuff. And that's one thing that we will be doing, some motivational, some influential type programming for that.
Great. Beverly, same question.
I want to applaud what Patty's doing. I think that's great, and I'm hoping that we'll do another webinar sometime where she shares all that information, because I think that'd be great. Steal from each other. I think the biggest thing we need to
call that collaboration.
Yeah, oh yeah. I think the biggest thing is to keep talking. Keep talking. Let's for us, we started knocking down some of those walls. Keep talking about what it is to age in your community. And here's the hard part: to get onto those commissions and those task force, that takes a lot of time. So maybe you can't do it, but maybe a board member could. But you need to have someone who's thinking of how it is to age. Every time a decision's being made on any of those commissions, you need to get people in there who can think in terms of elders.
I think it's storytelling. If the better stories you have, the impact of intervention, the impact of good health and exercise and that sort of thing. So you tell stories and put a name to it. And, and I think that's a big thing that we can all do as seniors, because I too am a senior. We have exactly 30 seconds left. Can I share my screen?
Mm-hmm.
Dan, will you let me share my screen?
Yep, hold on a second.
Yep, okay. I'm going to try and speak quick, because the next
There you go.
one, great, thanks. And where is it? The next one coming up, as I said, is going to be fundraising. And what I'd like for you to do, oops, I can't do show mode, so who cares? We don't have the date yet for the fundraising in the age of COVID, but send me your challenges and your triumphs and all of your comments relative to fundraising so we can build a meaningful conversation around it. You will be hearing from me a one-question survey plus some contact information for our panelists in case you want to talk to any of them individually. So if no one has anything else, we're going to conclude for the day and conclude on time. So thank you. And any comments that you have above and beyond what we talked about today, please make sure you just send them to me or to any of our panelists once you get their email addresses. Thank you very much. Thank you to the panelists.
Thank you.
It's been great.